Hello, and welcome to this Anatomy Physiology Bio 201 video lecture on muscles. I'm Mr. Kennedy, and I'll be your guide as we briefly explore this topic together. We begin today by looking at how skeletal muscles produce movement. Skeletal muscles produce movements by exerting a force on tendons. Tendons attach to and pull on bones, and movement occurs. Origin and insertion. Most muscles cross at least one joint and are attached at the articulating bones. When a muscle contracts, it draws one articulating bone toward the other. The origin is the attachment point to a stationary bone, while the insertion is the attachment point to a movable bone. Take a moment to examine the diagram at the right and identify both the point of origin and insertion for the muscles illustrated there. Lever systems and leverage. Bones serve as levers and joints serve as fulcrums. In order to achieve movement of the skeleton, muscles contract around joints and pull on bones as levers. The lever is acted upon by resistance and effort. Take a moment to examine the diagram at the right and familiarize yourself with each point of the lever system. There are three different types of levers that we find in the human body. First, second, and third class levers, each illustrated here. The first class lever is similar to a pair of scissors, where the fulcrum sits directly between the effort and load. The second class lever is much like a wheelbarrow, where the fulcrum is in front of the load and the load is in front of the effort. The third class lever is much like a pair of forceps or tweezers, where the fulcrum is behind the effort and the load. The effects of fascicle arrangement. Muscle fibers are arranged in parallel bundles within fascicles, but the arrangement of fasciculi in relation to the tendon can vary. Fascicular arrangement is correlated with the amount of power a muscle can produce and the range of motion a muscle can produce. This table will provide you with a detailed summary of the arrangement of fascicles in different muscles throughout the body. Be sure to take a moment to familiarize yourself with each fascicular arrangement. Coordination within muscle groups. Most muscle movements are coordinated by several skeletal muscles acting in groups rather than individually. Most skeletal muscles are arranged in opposing pairs at joints. Those pairs can be agonist, antagonistic pairs, and can also include synergistic muscles. The agonist is the prime mover, the antagonist resists the movement, and the synergist contributes to either of the aforementioned. How skeletal muscles are named. A muscle may be named based on its location, size, number of organs, appearance, direction of fibers, origin and insertion, or muscle action. This table will provide you with a detailed list of characteristics used to name muscle. Here you'll find the name of representative muscles, the meaning behind their name, and some examples. Superficial anterior skeletal muscles. This slide will provide you with a list of superficial anterior skeletal muscles. Take a moment to familiarize yourself with the muscles of the body. Learn each by position and movement. This is the superficial posterior skeletal muscles. Again, take a moment to familiarize yourself with each labeled structure. Learn the names of the muscle, their position, and their movement. Running injuries. Most running injuries involve the knee. Running injuries are usually related to faulty training techniques. Running injuries can be treated with price, NSAIDs, and rehabilitative exercises. Compartment syndrome. Compartment syndrome involves pressure constricting the structures within a compartment, resulting in damaged blood vessels. Left untreated, compartment syndrome can cause severe nerve damage. Muscles can also develop scar tissue, and contracture may result. Plantar fasciitis. Plantar fasciitis is a painful heel condition that results from chronic irritation of the plantar aponeurosis at its origin on the calcaneus. Treatment includes ice, heat, stretching, weight loss, prosthetics, steroid injections, and/or surgery. This concludes our brief look at the muscles of the body.